Okay. Okay. All right, so let's just do some quick introductions. If we could, just 30 seconds about yourself, who you are, and then why you are interested in being a part of this particular group. So this is the special needs or special healthcare needs work group as a part of the Pediatric Advisory Council for Emergency Services. So I can go ahead and start. My name is Julia. I think I've met all of you, but I am the EMS for Children coordinator here at the Bureau. Yeah, so Shelly, would you like to go next?
Sure. My name is Shelly Bissell. I work at the Bureau of EMS, and I'm here to support Julia and the public work group.
All right.
I'm Allison Welch, and I'm the time-sensitive illness and injury manager for the Bureau of EMS and Trauma at DHS. And my background is I'm also a paramedic, so it's have a little more insight onto the field perspective.
Okay. RJ, do you want to go ahead and go?
Absolutely, thank you. I'm RJ Dieters, flight medic and clinical educator for one of the air medical companies here in Arizona, and have been just a member of the group since earlier this fall. But I did a lot of EMSC work and state level Pediatric Advisory Council work in Minnesota prior to my coming out here in Arizona.
Thank you. All right, Jordana.
I'm Jordana Carpenter. I worked both EMS and pre-hospital, hospital, and I also have a special needs child.
Thank you. Dr. Bradley, I think you're the last person.
All right. This is Gail Bradley. I am the State Medical Director for EMS and Trauma for the Bureau of EMS and Trauma System at ADHS.
Thanks. Okay. So really the role of this group at this time, I think I just kind of kept the agenda very general in terms of identifying what the work group objective would be, and then kind of just discussing some possibilities for how we can move forward and work together in the future. What I'm thinking in terms of objectives for this specific group is I would love for us to kind of identify our objective as a group, and then based on that, consider maybe 1 to 2 specific project ideas that we could move forward with in working on over the next couple of months as a group. So feel free to jump in at any time if you have any input, but we can just start kind of discussing our objective as a group. So when you think of this group, why are you a part of the group? What are you thinking that we are hoping to accomplish? And I'll just kind of give you my ideas. I think I'm hoping that we as a group will be able to at least provide recommendations to implement strategies to improve care outcomes for children and youth with special healthcare needs, or improve EMS workforce readiness to care for children and youth with special healthcare needs. So just kind of use those maybe as a jumping off point. But does anybody have any input or comments as in terms of an objective for how we will move forward as a group?
Well, I guess my first question is, what has been done for education and, as you stated, Julia, workforce readiness, preparation, any kind of special skills or didactic classes for special needs kids? Has any special training programs been set and established yet?
That is a great question. In terms of Arizona EMS for Children, nothing that I am aware of, at least since I've been here, and nothing that I've been able to find has been anything along those lines. In terms of what's currently taught, I'm not sure. Allison or Dr. Bradley might be able to better speak on that, if there's anything out there.
There's nothing formalized. Each agency has the ability, or each education program has the ability to kind of modify that. It's of course in the initial paramedic training and initial EMT training for the state. However, and they do like our education requirements do require that they actually have a certain number of pediatric hours, but it doesn't necessarily say that it has to be towards a special needs or a specific type of pediatric training. And then Gail, I think, can probably add more to that.
Sure, thank you. I think one of the big things Arizona did several years ago was to mandate 5 hours of continuing education for every recertification cycle for pediatric specific training. And I think that is, pretty unusual for states, but it was one of the things that was brought forward as an important target to improve education amongst the EMS community in regards to pediatrics. That education and training, it can be broad. I am not aware of any specific education that has been done to address special needs pediatric patient population, but there is the 5-hour minimum component for just general pediatrics for all EMCTs.
Okay. Thank you for that explanation. Does that answer the question, RJ?
Yes, thank you.
Okay. So based on that, knowing that there's nothing specific, but we do have the 5 hours, does that kind of spark any ideas from anyone?
I might ask if Jordana has used the EMS system with her for her child.
Yes, great question.
Yes, I have actually, and it's not a very good system.
We got room for improvement.
It's difficult when you have a special needs child, especially when it's medically fragile special needs. My daughter has coded many times and has been to the ER many times. Every time that the EMS has come to my house, when we've had to call 911, it's been a lot of fumbling around and not really knowing what they're doing with peds, and I usually have to lead them in it and what we're doing. So like if I'm bagging her and I'm doing compressions, like I have to direct them into what I'm doing and go over everything with them as briefly as I can to get her loaded and get her into the back of the ride to get her to the hospital. It seems like they're very skittish around kids, especially if they're coding, which I understand. I mean, kids are scary. Nobody likes to see a kid code, but with our special needs, there's more factors into that when it comes to dealing with them, even if they're not coding. If they're nonverbal, the interactions with them are very different. I don't know, there's a lot that can go into this on that aspect of it.
Yeah, thank you for sharing. I spoke with Dawn Bailey, and she was sharing similar experiences with her daughter as well. And it seems like there could be small aspects, at least, of that we, based on your experience, if you, something small that we could kind of look at and say, this might be a strategy for helping a paramedic to feel more comfortable in this kind of situation, or something along. Just as a starting point, you mentioned having challenges with nonverbal communication. One thing that I've seen other EMSC programs do, and I have no idea if EMS agencies in Arizona have anything like this, but I'll just show you. They have created these communication cards that they have to kind of aid in communication. Let me try to find it. So if you can see the screen, I'm not sure if everyone's on a laptop or a computer, but basically it has pictures next to it. And there is a statement that says, for example, the paramedic is going to take care of me. I will be okay. So kind of pictures illustrating procedures or what a paramedic might be doing. I wasn't sure if anybody thought this could be a useful tool for EMS in Arizona. But there's one example here and then another example. And if you don't have a computer right now, I can definitely share these later. But even as simple as yes or no, different feelings. But yeah, that's just one maybe idea that of something we could try to do.
So the kid could point at the image for answering. That's a good idea.
Mm-hmm.
So in with that, I'm sorry, I'm just trying to log into my computer to see the images.
Oh yeah, no problem.
They are kind of like, they have programs called PEC for kids.
Mm-hmm. Yes.
That are nonverbal, and this is something that kind of plays into that effect.
Okay.
But the kid has to be familiar with it. So it takes a lot of time for kids who are nonverbal to establish talking with pictures. And if they're not familiar with it, this is going to be very, a lot for them to take into account.
Okay. Understood.
But there is a PEC system that it's called BoardMaker or Simple PECs. I can get you those images, and if they're standard pictures that they are used across the board, then they'd be easier for kids to understand.
Okay. Yeah, I would love to see those if you'd be willing to share.
Yes, I can email them to you, Julia.
Thanks.
So this is Gail. Based on what Jordana was saying, I think, when we think about the more critical encounters that EMS is going to have, especially with a pediatric patient with special needs, one of the things that we could look at is to create kind of resuscitation specific as kind of a starting point considerations when it comes to special needs population. So things that come, relate to airway management, considerations with bagging, if a child has any type of airway adjunct or tracheostomy, kind of how to manage or deal with that. Mm-hmm. And so just something to kind of maybe consider if we kind of try to break this into pieces of how we could look at this. Is there something that we could look at to kind of start with your ABCs? Because I think that's one of the things we always try to get EMS to go back to. If you're uncomfortable, if you're nervous, go back to your ABCs and kind of do it, address it in a regimented fashion. So are there kind of like tips and tricks of the trade that we could put together in a training for EMS that may help guide them in some of these difficult scenarios?
Yeah, that sounds like a great idea.
Yeah.
So that could be maybe one of our initial starting points is just kind of, like you were saying, choose a specific procedure, a specific topic, and then try to make some guidelines based on that, and then move forward with that.
I think along with that, and that's absolutely excellent, going to basics is the very first thing to work with. And then also communication skills. It's oftentimes challenging for pre-hospital staff to go into a situation that not only is a child, and we all get that, but now as a special need child with adjuncts and appliances and special considerations for interventions, to communicate back and forth, not only with the child, but with the parents as well. Mm-hmm. The parents and caregivers are oftentimes the very best and greatest resource as to how to work with and intervene and what to do. And on the special needs kids that I've transported, I totally ask, what do you want me to do? What's best for your child that works within the medical guidelines that we put in our care plans for them at the time. So a good communication skill and element, along with the cards and learning how to interact with the parents and the patient and the ABCs, I think is a very good starting point.
Okay, thanks for that feedback. Okay, so we have kind of the basic, maybe guidelines for specific basic procedures, working on communication skills. Does anybody have any other ideas, or do you want to kind of focus on those 2 points for now and then see how we can work on those and move forward with that?
Hey, Julie, I have a quick data question.
Mm-hmm.
Is there a data element we could look up as like the most common call?
For we could look at the pediatric report and see what the most common call is for pediatrics. I'm not sure.
It might not tie in with special.
Yeah.
Okay, never mind.
That's a good question. I don't know if Allison or Gail has any further insight on that.
This is Gail. I mean, as part of our pediatric report, we did look at kind of the most commonly administered medications as well as procedures in pediatric patients.
Mm-hmm.
Surprisingly, fentanyl was one of the more commonly administered medications for pain control. And I think that was actually a good thing to see. The issue comes down to when you start narrowing that focus to kind of the special needs population, some of the more common things may not necessarily be relevant. And some of the more common things are probably things that are easier and more comfortable for EMS to do, like treating pain or treating hypoglycemia, because they kind of do the same thing, adult and peds, it's just a little bit lower dose. So I think maybe focusing, one of the things that with pediatric education, I've always tried to say, if the parents are there and they know their child's medical device or equipment, make sure that you engage them with that process. And I think that is definitely an important piece to kind of reiterate throughout this. I think generally, as Georgiana can probably attest to, typically the parents have kind of gone down their whole algorithm of how to intervene before they've even called 911. So at the point that they're calling 911, they recognize that they need assistance and they've kind of tapped out what they can do and that their child needs to go to the hospital. So I think some of that maybe education to EMS about what education and training the parent gets may help EMS understand why it's really important to listen to the parents.
I agree with that completely. A good human factors, human communication element goes into that. Agreed.
Okay, so if we are talking about that, what would we want that to look like? Would it be an education module? Would it be like just a paper with some guidelines or information, or like a handout, or how would we want to distribute that type of information?
Is the information, sorry, you lost me on a little part of that. Is the information for EMS providers, or is it for EMS providers to like have and show for families? Or
for EMS, so this would be for EMS providers. So we are essentially would be educating EMS providers on how to best interact with parents of a special needs child, kind of including information such as like make sure you are engaging with the parents. The parents are the best, like know their child the best, and they have gone through a lot of education to understand how to care for the child. So making sure that the EMS provider is aware of that, and so they're not going into the situation thinking that they know more. Maybe they do, but about the specific child, the parent knows is the best person to connect with, if that makes sense.
So that makes
So for the EMS,
Yeah.
okay.
If I may just, my experience with it from in the past, what we have done is put together a special needs children training day for EMS providers. In that we did simulation. We did simulation a lot. We had a mannequin with different adjuncts and appliances, and depending on the scope of the day, we would have simulated patients, simulated parents, that kind of thing, that taught communication skills in a simulation setting. And then at the end of the day, we would send them home with just a little badge buddy pocket guide kind of thing to say, engage parents, ask medicines. And I agree with Dr. Bradley, the thought of if they're calling you, they're already well past their capacity to manage it. And what should we be looking for and doing for in terms of the transport? So we did ours an awful lot through simulation education days, and then at the end sending them home with things like these pictures and other, like I say, badge buddy items that we could work with. That may be on the scope of whatever you're wanting to work with here, but that's kind of the way we started. And then we had a couple levels of it. The very basic stuff, ABCs, what are the primary adjuncts and appliances that we may need to intervene on. And then the next step would be, here's all the portacasts that they have, and here's all the other things that they have, and here are the different syndromes and that kind of thing. So we had kind of a graduated level of education. Again, perhaps beyond the scope of what you're wishing to start with, but that's my experience anyway.
Yeah, thank you for sharing. That's really helpful. I think in terms of a starting point, we might want to start a little bit smaller just so that we can kind of have smaller bite-sized chunks of things. But that sounds like it could be something to work towards. I like the pocket guide idea. So maybe we could start by even just kind of creating something similar to that, or focusing on just specific procedures or specific challenges, and then kind of build up from there.
Mm-hmm.
So it sounds like we have a couple of project ideas. Does anybody else have any ideas or any input that they want to share? No? Okay. Well, I guess in terms of next steps, I will write down our notes from this and kind of pinpoint exactly what we have discussed doing, and so that we can move forward with that. I think again, the main two topics were, we talked about kind of creating some guidelines for basic procedures or what how they might approach the situation, and then also communicating with the parents and just kind of hopefully provide the EMS provider with a broader understanding of how to interact with the parents, what how to approach them, maybe what things to let them provide input on and things like that. So those would be our two main initial projects or focus areas. Does that sound correct to everybody?
Yes.
Yes. Okay.
Yes, that's fine. Yep.
Awesome. Okay. Well, I mean, this is a short meeting, but does anybody else have anything else to add or anything they want to discuss? Otherwise, we can just kind of move forward with those two pieces. And again, I'll write up the notes and then be in touch with next steps.
My only other thing is when we're interacting with the parents, sometimes the parents have nursing staff at their home as well. So that might be
So it kind of include how to interact with them.
Yeah, because some families have nurses, like if the kids are on trachs and vents and other stuff like that, if they're medically complicated, there's nursing staff in the home sometimes.
Mhm.
Okay.
Yeah, very good.
Thanks for that.
And perhaps just as a thought off of that, it won't always be in the home where we encounter these kids. We'll see them, well, perhaps now not in the current environment, but at school,
Yeah,
at churches, shopping malls, wherever. So again, parents and caregivers will be with the child, obviously, but it may not always be in the home setting as well. Just as, a side thought to what we're putting together. Not always the home. It may be they may be driving to the hospital and they're off to the side of the road somewhere on an interstate because something really did go south quickly while they're driving. So
Okay.
Or at school too. Like my daughter goes to a special school for medically complex kids.
Oh yes.
So that might be something to keep in ideas about too, is that these schools have staff on hand, but it's not the parent or the actual guardian that's going to be with the kid that goes to the hospital with the EMS crew.
That's right. Agreed.
Okay. Okay. Is there anything else anybody wants to discuss here? Otherwise, what I'll do is draft up these notes, and then probably what I'll do is get like a Google document started or something like that, so we can start compiling ideas and focus points for what we would want to have in the guide, and then kind of work from there, and then meet again to discuss specific items in the guide. Does that sound like a good plan?
Yes. Thank you.
Yes.
Oh, that sounds good. Yeah.
Okay. Then that's what I'll do. Does anybody else have any last words or last questions or anything like that?
I think if they could look at this topic annually, it could be helpful for the providers.
Yes, I'm sure. Okay, well, thank you everybody for joining the meeting. This was a really good discussion. I know we didn't talk for that long, but I think we got some clear action points and next steps for moving forward. So that's really awesome. If you have any ideas or anything else, or want to talk one-on-one, anything like that, feel free to reach out, and I would be happy to discuss this further. But otherwise, I will just be in touch with our next steps. Again, draft up the notes from this discussion, and then we can move on from there.
All right. Thank you.
Thank you.
All right. Thank you everybody for joining.
Thank you.